afternoon and thanks for joining us. I'm Judy Simpson. Our focus this afternoon is on Parkinson's disease. About 1 million people in this country are living with Parkinson's, and another 50 to 60,000 new cases are diagnosed each year. Caregiving is one of the many challenges brought on by Parkinson's. To find out more about the disease and the support services here in Vermont, I'm joined by two guests. Dr. James Boyd is a neurologist with the Fletcher Allen Healthcare and the UVM College of Medicine. He is the director of the Binter Center for Parkinson's Disease and Movement Disorders. Also with me is the Reverend Lyle Miller. He's from Belvedere, Vermont, and he serves on the board of directors of the Vermont chapter of the American Parkinson's Disease Association. Thanks so much for being with us.
Thank you.
Dr. Boyd, what is Parkinson's disease and what happens to people who get it?
So Parkinson's is a progressive neurological condition. It's causes a loss of the dopamine-producing cells in a specific area of the brain. Dopamine is a neurochemical which regulates one's ability to move and move in a coordinated fashion. The reduction in that brain chemical produces a combination of symptoms including stiffness, slowness, shakiness or tremor, and difficulty with mobility, with walking and balance difficulty.
And so tremors are just one of the symptoms?
That's right, yes. There are a number of different symptoms that can go along with it, as I mentioned. Tremor is clearly the one that is most identified as being associated with Parkinson's, but the other cardinal symptoms do include a combination of stiffness or muscular rigidity, slowness, and walking and balance differences. Mm-hmm. People also will have some differences in the quality of their speech. It may be lower in volume, it may be more hoarse or more monotone. And additionally, they may have some difficulty with fine motor skills of the hand, such as difficulty with handwriting.
And so when is this sort of diagnosed and detected?
So it's most commonly a disorder of an adult. It's more common as people will age. The average age of diagnosis is between 55 and 60, with the incidence increasing with age as people get older. Mm-hmm.
And so let me bring in Reverend Miller to our discussion. Your wife Rachel was diagnosed with Parkinson's in 2000. Mm-hmm. Did it start with these symptoms?
Basically, we were made aware of the symptom from members of my congregation who noticed that she had slowed down in her gait. She had difficulty making turns, and her speech was getting weaker, and she also noticed that she was having a hard time to write her own name. Mm. And so we were advised to go see a doctor, which we did, a neurologist in Cooperstown. He walked her down the hall, had her do some turns, and came back and said, "I think you have Parkinson's." He gave her some medication, L-Dopa, dopamine, and she began to walk okay while she was on the medication. So we went back to him, he said, "You have Parkinson's."
And so how is Rachel doing?
She's in the advanced stages now. She has difficulty writing very hard. She has difficulty in speaking, hard to hear her. Her voice is very soft. Her coordination in feeding herself is even more difficult. Many falls, memory loss, a lot of different things that are going on now.
And so how many people have Parkinson's?
Oh boy, I don't know. Many.
It's estimated that there are 7 to 10 million, I guess, worldwide.
Yes, right.
And so, but a lot of these cases go undetected, I would imagine, because some of those symptoms, to me, sound like they could be something else.
That's true, and as I said, the only way she was diagnosed by giving her some medication to increase the amount of dopamine in her brain, which controlled her ability to walk and function. And with the improvement, that was her diagnosis.
Yeah, do you have any idea as far as how many people in Vermont are diagnosed with Parkinson's or have Parkinson's?
Yeah, we've attempted to make some estimates in the past. It's important to know that Vermont is the second oldest state in the country. As a result, diseases of the aging are really quite common here. Based on just the population and estimated average age, we believe there's somewhere around 2,000 Vermonters who have Parkinson's.
And so, is there a cure?
There is not a cure at this time. We're currently active in research for things that may prevent the development of Parkinson's in those who we think may be at risk, as well as looking at things that may stop or slow the condition from progressing when it is identified. That's a major area of focus with respect to research these days.
Is there a typical progression as far as number of years, or does it vary from person to person?
It's extremely variable. We talk about the different motor stages of Parkinson's and the progression from often one-sided symptoms to two-sided symptoms, the development of balance problems, an increase in the need for assistance and increasing symptoms on both sides. That progression can take anywhere between approximately 10 years to as many as over 30 years. So there is a huge variability in terms of the progression for any given person.
Is this disease inherited?
So there is a small percentage where it is clearly inherited. This is less than 10%. It's only 1 to 3% where there is a very strong inheritance, and the other percentage have what are called susceptibility genes, meaning it runs in a family. You may have a great aunt or uncle or a grandparent, but it's clear that not everybody, or less than 50% of those in these families, develop Parkinson's. The vast majority, we believe, are what are called sporadic, and that there may be some environmental causes of this.
And so it doesn't really do any good to be sort of pre-tested to see if you're predisposed?
No, the genetics are really quite rare, so it's difficult without a clear family history in that small percentage to consider testing for some type of a gene that may put them at risk.
So what's on the horizon for research and treatments?
So there are quite a number of activities right now in terms of larger research projects looking to better understand how we would detect Parkinson's in those who are at risk, as well as understanding the progression of the disease. Historically, we've determined whether or not Parkinson's is getting worse based on the physical symptoms that develop. As a consequence, it gets quite tricky to understand if we are successfully stopping or slowing the condition. So right now there's a large initiative through the Michael J. Fox Foundation support, something called the PPMI study, which is the Parkinson's Progression Marker Initiative. And they're looking for a biomarker or some way to measure the intensity or severity of Parkinson's other than the clinical symptoms. Additionally, there are several studies ongoing looking at potential disease-modifying therapies, looking to see what we might be able to give to slow the condition after it has been identified and diagnosed. And we're doing several of those studies here at UVM.
Really? And so are you asking for people to participate, or is that already underway?
So both. So we have one study which is no longer enrolling subjects, looking at, interestingly, an anti-diabetes medication which has been shown to be protective against the loss of brain cells, and particularly dopamine-producing cells I mentioned earlier. This is a medication called pioglitazone. That study is not enrolling currently, but we are completing the study as we speak. Additionally, we are coordinating a study and working with our collaborators in Germany, looking at nicotine as a potential neuroprotective agent. And there's an interesting history to this. Approximately over 40 studies have shown that smoking has a protective effect in reducing your development of Parkinson's.
That's not something you hear every day.
No, and it's not common knowledge, and by no means am I suggesting that people should go and smoke, but the question at hand is whether or not introducing nicotine after the diagnosis has been made may be able to slow the condition and have a protective effect even after the diagnosis has been made. And that study's ongoing at 10 sites in the United States, 10 sites in Germany, and we are coordinating the United States effort. So we are looking for participants who are in the early stages of the condition to participate in our study.
That's pretty exciting.
Very exciting, yeah. It's been a long time coming, and we're really happy to be doing this study.
Okay. Well, if you're just joining us, we're learning about Parkinson's disease. There is a website that can help connect Vermonters with information about Parkinson's. The site also provides support networks for caregivers and families and offers treatment and exercise options for patients. The web address is on your screen for the Vermont chapter of the American Parkinson's Disease Association. You can go to parkinsonsvt.org. Well, joining us now is another director of the Parkinson's Disease Association. It is a pleasure to welcome Angela Corbin of South Burlington. Thanks so much for being with us.
Thank you for having me.
Now, Angela, tell me about your story. Your late husband suffered from Parkinson's disease, and what do you want people to know?
He did have Parkinson's disease for 30 years, and he actually did quite well until the last 6 or 7 years, when the disease really did progress much more rapidly. And a lot of the challenges were mainly preventing him from falling, which was quite a big issue. And later on, as Lyle has mentioned, his speech became more slurred and quieter, much lower in volume. And at in the last year, I would say, the cognitive skills were affected as well.
And so what are some of the challenges facing families that are affected by this disease?
I think one of the major things is just to make sure that your loved one is safe at all times. And as the disease progresses, of course, that becomes more of an issue. Making sure, as I said, that they're in a safe place, that they're not apt to fall. Falling is a great fear. And especially for people who work outside the home and leaving their loved one, fortunately there are quite a few agencies in the state that can help with that. And they can send nurses, skilled nurses in, or home care aides to be a companion, to help with medication, and just to be sure that the patient is safe and has a meal if necessary.
I think we have a poster too about an upcoming fundraiser for these very issues.
That's true. We are having a fundraising dinner on October 11th at the Catamount Country Club. And one of our featured guests will be Rusty DeWeese. So we're looking forward to that.
That'll be a fun night.
That'll be a fun night, yes. We're looking forward to that. And it's actually the kickoff of Rusty's Vermont, New Hampshire holiday tour. So we're thrilled to have him.
And also, Reverend Miller, there's something called the Choices for Care program. Can you tell us about that?
Well, that's run by the Office on Aging here in Vermont. We became involved with that because at first my wife was receiving some assistance from home health, somebody coming in twice, 3 times a week to help with her bathing and help with some housekeeping and give me a little bit of a break. And then as she progressed and got more and more debilitated, they came in and they did an evaluation. The first evaluation didn't work out. She wasn't considered to be a high enough level to be able to be qualified for choices of care. The second time around, they did an evaluation and she was elevated to the highest needs level, which means I can hire somebody to come in and take care of her needs when I'm gone up to 42.5 hours for a 2-week period. And that's paid by this program. It also puts her qualified for Medicaid, which pays for her medications. This has been a tremendous relief. As Angela says, the biggest thing is falling in their safety. And my concern with my wife's situation is using a walker and forgetting it.
Right.
And or carrying something in one hand and pushing the walker with the other hand, and and having no control. She's fallen several times. She's cracked a rib. She's had a cracked tailbone, buttocks, if you will, crack in that area. Many bruises. It's a chore.
So along with services for your loved ones, it's also important to take care of yourselves as well.
Exactly, Judy. It's important for the caregiver to get enough exercise, to eat healthy, and to even seek professional help if they feel that this is getting difficult for them to deal with. A lot of times also the patient is reluctant to talk about the fact that he or she has Parkinson's disease, and they very rarely even want to talk to their own family about it. In my case, fortunately, my son and daughter-in-law live nearby, and once they realized the difficulties, they were much more involved, which was a great help. And it was wonderful for my husband as well, because he had his son there,
right?
And Chris would come and take him to lunch and take him out and do things like that.
That's so wonderful. How can our viewers learn more about Parkinson's disease and the Vermont Association?
They can go to our website, which is www.parkinsonsvermont.org. We also have an information and referral center based at Fletcher Allen, and that phone number is 888-763-3366. and the individual who is our I&R coordinator will be happy to give anyone any information regarding services and doctor care and anything of that nature.
And it's important, too, that if people have any questions, get answers.
Absolutely. And the one thing I do want to mention, too, Judy, is I found journaling to be very helpful. It served a lot of different purposes. For me, I could write how I was feeling, on any given day. And it's helpful also because if your loved one is going to a physician every 3 months, say, it's hard to remember when a certain behavior began and how it progressed. So it's helpful not only for the caregiver, but also for the doctor, so that the doctor knows how to treat the person and prescribe the correct medication.
I want to thank you both for joining us. That's very good advice.
Thank you.
That's our program for today. I'm Judy Simpson. I'll see you again next time on Across the Fence.
For a video copy of today's program, call toll-free 1-888-ATF-3430. Across the Fence is brought to you as a public service by University of Vermont Extension and WCAX-TV.